Good evening and welcome to our Senate District 44 interview with Dr. Debbie Bryant. We have with us a few SE for Ed members and representatives in the Low Country, and we are going to get started with our interview with Dr. Bryant by allowing her no more than 3 minutes to provide her opening remarks to us. So Dr. Bryant, you have the floor.
Thank you so much. I appreciate this opportunity to come before your organization to share my values and my thoughts on why I'm running, and to also share with you the importance that I feel our public education and schools are for our students and our children and our families. I'm a nurse. I'm a registered nurse. I'm a product of Berkeley County. I grew up in Moncks Corner. I married my husband, moved away, but we've been back in the Berkeley County area for quite some time now. I have two grown children that went to Stratford High School. I've been a nurse, started as an associate degree nurse and worked my way through the education system to earn my doctorate in nursing practice. I've been working in public health for about over 20 years as a public health nurse. The decision to run, why I wanted to be a state senator, is I understood with healthcare and public health that, particularly after the COVID crisis, that we need our public health and education systems to work for us. And I felt that I could bring that expertise to the State House. So I'm here as a newcomer to politics and running for an office. I get the question all the time, how is it to run during the COVID pandemic? And I said, well, I don't know any other way. So for me, I guess it's just normal. So I'm excited about this opportunity. I'm excited about serving the state of South Carolina and serving District 44 as a state senator. And I want to bring the value of every citizen, particularly those in this organization that care about education, to our State House. So that's who I am, and love to hear more about your organization and answer any questions you have. Thank you.
Thank you, Dr. Bryant. We will begin our interview with our first question. And that question is, what is your opinion of the state of public education in South Carolina today?
State of public education today. Well, again, I said I'm a product of the South Carolina schools. So are my children and my husband, frankly. I also work in higher education, so we know how important school systems are, from pre-K to secondary education to post-secondary education. Those who want that path for themselves, they should be able to achieve that. So I think, of course, we all know that our school systems could use some improvement. And I believe that's starting with teachers' pay. Every other profession, if you're a physician, if you're a lawyer, if you're an accountant, and for nurses, our salaries are catching up in the profession, and we are paid the value of what we're worth, I believe. And so for teachers, I think that the same things have been happening, and we've been working on that way too long. So I think we need to do whatever we can to ensure that teachers' pay reach the national average, and South Carolina is no longer falling behind in that area. I think classrooms should be resourced as needed. And I don't know the answer to all of what that means, but certainly for teachers would help to offer that to experts, so to use your expertise. Broadband access, I think, for rural schools is one of the things that's a part of the improvement that we could use for our public education and schools. And I also think maybe a pipeline program for teachers to help teachers who want to develop from high school to into their college programs, and the success so that they are ready to go back into those areas that they grew up in, understand, live, and to help have others support their growth and development for those students. So those are the things that I think is important for public education today.
Okay, thank you very much, Dr. Bryant. The next question we would like to know is, if elected, what would be the first step you would take to improve public education?
First step for improvement. Well, I'm going to start with where I started the last time. Teachers should be paid a fair and reasonable salary. That is, again, something that I frankly also, probably as most members of your organization, has been asking, why is it taking so long? Why are we falling behind nationally and not meeting just the catching up to our neighboring state, North Carolina, Florida, Georgia, Tennessee? All of those states seem to be doing better in paying the teachers and paying for the expertise to ensure that our schools meet the right objective for our students. So that is what the first step that I would take, is to seek out advice from your organization and others who value that growth and development of the students, of teachers' salary, to find out what those issues have been. How do we dive deeper into our state budget so that we can change and ensure that teachers are valued the way that they should be?
All right, great. Thank you very much. You kind of led us into the next question that we were going to ask, and that is, Dr. Bryant, if elected, what would you do to address the funding of public education in our state?
So, I think I would have to think about this as the way I think about, how do I address funding in my own home? After this COVID crisis, we know that money is going to be an issue. We have so many things that our economy, we are not going to be able to support in the same way that we did previously. However, for my home, I have to think about my family. So paying the mortgage is important and is a part of my budget. Buying groceries is important and is a part of my budget. We have to have lights, we have to have water, but maybe I don't need the cable. Maybe I won't take that vacation. So I think our budget for the state system, for our state budget, would have to follow those guidelines. Schools have to be funded. We have to be able to ensure that our students are on the road for success and can compete nationally. So I think we would then put the money in our budget, put our money where our mouth is, and make sure that our schools are top priority in our state budget. That's how I would think about it, and that's how I would argue for it.
All right, great. Thank you very much for that response. And finally, we are at our last question.
Oh my.
Dr. Bryant, in your opinion, what would be a successful accountability system for education in South Carolina? What do you believe that accountability system should look like for students, teachers, schools across our state?
Accountability. Can you help me a little more with what your accountability in dollars, accountability in
For example, because of COVID-19, our state superintendent asked for a waiver for the standardized assessments that our kids typically take in the school year. That is considered one form of accountability.
Yes. So we have the same thing in higher ed. We had to look for accreditors to give waivers and different testing or models, those kind of things. So COVID and the crisis that we are in means that disruption is happening to our systems. In that disruption, there is room for innovation. Things need to look a bit differently. We see that in higher education now. They're asking the question, do we need the ACT, SAT, those kind of things. I think I would ask, because we were forced to look at testing structure, do we need them? Do we need to think about them differently now that we know different models work? However, maybe a one size does not fit all for every student or every locality. So how do we make those adjustments? How do we answer that question to ensure that testing structure is about a student's success, not about the next test? So I think that's how we would go backwards to answer the question, are we testing to test, or are we testing to get an answer? And are there new models out there, best practices, structures to help us get to that ensures that the students are the priority of the system rather than the test is the priority of the system?
Mm-hmm. Mm-hmm. Great. Thank you very much, Dr. Bryant. And that concludes our questions for SE for Ed. And now we're going to give you a total of up to 3 minutes for any closing remarks and final thoughts that you would like to share with the voters in your district.
Okay. So what I would remind the organization and voters is I stepped up and stepped into this because I believe that my voice will bring value, that I will be a person that can listen to the science and to the remarks of the citizen, to organizations such as yours, to be able to make the best decision for the state. I think all too often we've had leaders that have just kind of been in the lock and step mode for so long because that's what they've known, that's what they've done. And it's time for new leadership. It's time to think differently, to build differently. And I also believe that it takes the expertise of the people who are sitting in those seats. Teachers, we need to hear from teachers about what needs to happen in our schools. Teachers, parents, students, as we are making decisions. So I'm going to look for expertise from those individuals who have them, rather than making decisions that it's only in my head. Because of my experience in public health, I've had to be able to be the person that listens more and talks less, and I want to be that leader. So I hope the voters in this district will give me a chance to prove that I will serve them in this role and not anyone else other than the voters that sent me to office. And to be able to do and be a valuable commodity for the state of South Carolina and its citizens. So please check out my website, debbieforsenate.com, and if you believe that I can serve you, I ask for your vote. So that's it.
Well, thank you very much, Dr. Bryant, for your time and for your responses. Just as a reminder to you, we will have this video posted on the SE for Ed website. It should be posted as early as, I believe, next week, if not sooner. Okay. And we will also be posting it to the SE for Ed regional social media. So please, share that information with your voters. And again, we thank you. We thank you for your time and your service, Dr. Bryant.
Thank you.
And we appreciate your time for this interview.
Thank you. Thank you so much.
It was good to see you.
You
Thank
too.
you.
You too.
Take care. Good luck.
I have to say,